Good evening, doctors. Welcome again. Today we are going to discuss about NEET ENT MCQs for plab exam. A 5-year-old girl had earache and some yellowish foul smelling discharge, perforation at the attic and conductive hearing loss. She has no past history of any ear infection. What is the most appropriate diagnosis here? So this is a case of acquired cholesteatoma developed as a result of chronic middle ear infection are usually associated with perforation of tympanic membrane at the attic. Mass is seen in attic with perforation at parts flaccida is contrast to medial or tympanic membrane, which is congenital. Clinically, presentation usually consists of conductive hearing loss, often with purulent discharge from the ear. In congenital mass medial to the tympanic membrane, normal tympanic membrane, no previous history of ear discharge, perforation of ear surgery. Okay, now a 30-year-old man present with 5 centimeter neck mass anterior to the sternocleidomastoid muscle on the left side in its upper third. He states that the swelling has been treated with antibiotics for an infection in the past. What is the most likely cause? So this is a cause of brachial cyst. This is a cause of brachial cyst. So this is brachial cyst. Justify your answer. Okay. Brachial cyst is anterior triangular lump. Parotid is also anterior triangular lump. But parotitis regresses with appropriate treatment and became normal in size. Pharyngeal pouch is posterior triangular lump. Thyroglossal in midline lump. Thyroid swelling moves with swallowing. Hope this is clear. Okay. Now, 30-year-old man complains of hoarseness of voice. Exam unilateral immobile vocal cord. What is the most probable diagnosis here? See options in front of you. And this here the answer is unilateral recurrent laryngeal nerve injury. Unilateral recurrent laryngeal nerve injury. Okay. Now, 20-year-old pop star singer complains of inability to raise the pitch of her voice. She attributes this to the thyroid surgery she underwent a few months back. What is most likely diagnosis here? External laryngeal nerve injury. This is functions to tense the vocal cord by activating the cricothyroid muscle, increasing pitch. Okay, now 10-year-old boy presents with nose bleeding. What measures should be taken to stop the bleeding? All options in front of you. Now take time to answer. And here the answer is press the base of the nose. Okay? Press the soft part of the nose. Okay. An 8-year-old returned from Spain with severe pain in one ear. Exam. Pus in auditory canal. Tympanic membrane looks normal. What is the treatment option here? Give gentamicin topical. Yeah, gentamicin topical, and diagnosis here is otitis externa. Okay, now patient presented with hemoptysis 7 days post tonsillectomy. What is the next step? Admit and give IV antibiotics. Infection is common cause of secondary hemorrhage. Patient should be admitted to observe the course of bleeding and treatment is given with IV antibiotics. Okay. A mentally retarded child puts a green pea in his ear while eating. The carrier confirms this otoscopy shows a green colored object in the ear canal. What is the most appropriate single best approach to remove this object? It is mentally retarded, so always do general anesthesia. Under general anesthesia, remove it. Okay. P is not a magnetic material, hence it cannot be removed by magnet. It will swell up if syringing is attempted, as hook placement is likely with risk of pushing the P deeper. It is not also suitable in a mentally retarded child, and olive oil is not help in case of P. So to avoid injury, it is better to remove under GA. Okay. 32-year man presents with hearing loss AC more than BC in the right ear after Ryan's test. He also complains of tinnitus, vertigo, numbness on same half of his face. What is the most appropriate investigation for this condition? Go for MRI because this is a case of acoustic neuroma. MRI, yeah, suggestive of acoustic neuroma, so MRI is preferred option here. Okay. 31-year-old man has epistaxis 10 days following polypectomy. What is the most likely diagnosis here? So this is a case of nasal infection. Okay. Case of nasal infection. Infection is the most important cause of secondary hemorrhage. Infection is most important cause of secondary hemorrhage. Okay. A 5-year-old child complains of sore throat and ear itch. He is pyrexial, exam tonsils enlarged and hyperemic, exudes pus when pressed upon. What is the single most relevant diagnosis here? 5-year child, sore throat, earache, pyrexial, tonsils enlarged, hyperemic, exudes pus pressed upon. This is a case of acute follicular tonsillitis. It is usually caused by viral infection or less commonly a bacterial infection. The given case is a bacterial tonsillitis probably caused by a group A streptococcus. There are four main signs that tonsillitis is caused by a bacterial infection rather than a viral infection. Okay. They are high temperature, white pus filled spots on tonsils, no cough, swollen and tender lymph nodes glands. Okay. Now, a young patient is complaining of vertigo whenever she moves sideways on the bed. While lying supine, what would be the most appropriate next step? Go for test like head roll test here. This is a case of benign paroxysmal positional vertigo for which the diagnosis is made by head roll test. Okay, diagnosis is made by head roll test. 26-year-old man has become aware of increasing right-sided hearing deficiency since her recent pregnancy. Her eardrums are normal. Her hearing test shows BC normal. Weber test lateralizes to the right ear. What is the single most likely diagnosis here? Otosclerosis. There are no features of encephalopathy. As Weber test is lateralized, is unlikely to be functional hearing loss. Tympanosclerosis eardrum becomes chalky white. So as the eardrum is normal, it is not tympanosclerosis. Weber test is lateralized to the right and deafness is also in the right. So it is not sensorineuronal deafness. but conductive deafness, which makes otosclerosis as the most likely diagnosis here. Okay, now 30-year-old lady has epistaxis for 30 minutes. Her hemoglobin is normal, MCV normal, WBC normal, PT, APTT, bleeding time are normal. Where is the defect? Defect is anatomical. Anatomical bleeding time, coagulation profile, hemoglobin, cells count parameters are normal. So the cause of bleeding here is anatomical defect. Okay. 52-year-old man whose voice became hoarse following thyroid surgery 1 week ago shows no improvement. What anatomical site is most likely affected? Unilateral recurrent laryngeal nerve is affected. Okay. A 10-year girl has been referred for assessment of hearing as she is finding difficulty in hearing. Her teacher in the class, her hearing test shows BC normal, symmetrical AC threshold reduced bilaterally. Weber test shows no lateralization. What is the single most likely diagnosis here? 10-year girl, difficulty in hearing in class. Hearing test shows BC normal, symmetrical AC, reduced bilaterally. Weber test shows no lateralization. So diagnosis here is chronic secretory otitis media with effusion. Yeah. 4-year old has ear itch with fever, has taken paracetamol several times. Now it's noticed that he increases the TV volume. His preschool hearing test shows symmetric loss of 40 decibel. What is most likely diagnosis here? Otitis media with effusion. Okay. A 4-year-old boy who previously had normal hearing has a mild ear ache relieved by paracetamol. He has been noticed to turn up the volume on the TV. He has bilaterally dull tympanic membranes. His preschool test shows symmetrical loss of 40 decibel. What is the single most likely diagnosis here? This is a case of otitis media with effusion. Otitis media with effusion. Okay. A teacher had a respiratory infection for which she has prescribed antibiotics. After antibiotic course, when she rejoined school, she lost her voice completely. What is single most appropriate diagnosis? Larynx. So answer here is functional dysphonia vocal cords. Functional dysphonia vocal cords. Functional dysphonia is a poor voice quality without any obvious anatomical, neurological, or other organic difficulties affecting the larynx of voice box. It is often secondary to viral infection. A 25-year-old woman complains of dizziness, nausea, vomiting, visual disturbance, and anxiety, which keep coming from time to time. Most of the attacks are associated with sudden change in posture. What is most likely diagnosis? Benign paroxysmal positional vertigo, dizziness, nausea, vomiting, nystagmus, which keep coming from time to time, are common features of BPPV. Okay. 56-year-old man patient presents with intermittent vertigo, tinnitus, hearing loss. What is the best drug treatment for this patient is? Buccal prochlorperazine. Yeah, probable case of Meniere's disease treated by with chlorperazine. Patient had fight, following which he develops bleeding, ringing, and hearing loss from 1 year. What is the investigation of choice? So here is investigation of choice is otoscopy. CT is the wrong key. Correct is otoscopy. Okay. Now already discussed. A 10-year-old man child was bought by his mother complaining that her child watches TV at very high volumes, doesn't like to play outside, instead has become more sincere with reading. She also says that her son doesn't respond to her. What do you expect to see on otoscopy? Bluish gray tympanic membrane with air fluid levels. This is occurs in conductive deafness, so child watch TV with high volume and does not respond to others for the deafness. Okay. A 5-year-old girl has had an URTI for 3 days and has been treated with paracetamol by her mother. For last 12 hours, she has been hot and irritable with severe pain in her right ear. What is most likely diagnosis here? It's otitis media. Yeah. 28-year-old man complains of vertigo, nausea, vomiting for more than 30 minutes and tinnitus, hearing loss in the left ear. What is the treatment for this patient? Buccal prochlorperazine is the right answer. Cyclazine is more C is in option key, but more appropriate is buccal prochlorperazine. Okay, now already discuss. A man present with hoarseness of voice. He has swollen vocal cords. BMI 32. Smokes 20 to 25 cigarettes per day. What would you advise him? Stop smoking. A patient present with hemoptysis 7 days after tonsillectomy. What is the next step? Admit and IV antibiotics. Secondary hemorrhage can occur from sloughing of tissue from surgical wound following infection. Okay. 17-year-old lady present with worm in her ear. She is very agitated and anxious. What is the next step? Alcohol drops. It is living object, so it should be killed first, and so alcohol drop is a correct option. Okay. Patient with sensorineuronal hearing loss (SNHL) and loss of corneal reflex on the left side. What is the most definitive investigation? MRI of internal auditory meatus. Okay. MRI of internal auditory meatus, likely cause is acoustic neuroma, for which appropriate investigation is MRI internal acoustic meatus. Okay. 45-year-old woman present with rotational vertigo, nausea and vomiting, especially on moving her head. She also had a similar episodes 2 years back. These episodes typically follow an event of runny nose, cold cough, and fever. What is the most probable diagnosis? This is a case of vestibular neuronitis. Here, no sensorineuronal hearing loss. Presents in acoustic neuroma, Meniere's disease, and labyrinthitis. Runny nose, cold, cough, fever recognized trigger vestibular neuronitis, but not BPPV. Okay. A child playing with toys suddenly develops breathlessness and stridor. Which investigation will lead to the diagnosis is laryngoscopy. Breathlessness and stridor in a child playing with a toy is most likely due to aspiration of foreign body, toy or a part of toy for which laryngoscopy should be done. A boy injured his ear during a rugby match. He reported it being painful. Exam red and tender pinna. Tympanic membrane was normal. What would be the next appropriate step? So, C, which is the answer. No further intervention needed as tympanic membrane is normal. So this transient inflammation of pinna from injury during rugby match is self-limiting, which needs no further intervention. Okay. A 45-year-old man present with hearing loss and tinnitus in the right ear. Exam Weber test lateralized to the left. Audiometry AC more than BC in both ears. What is the next best investigation is MRI. Yeah, MRI brain. Okay. Rhines positive. The deafness is not conductive. Again, hearing loss is not on right side. Weber lateralized to left. We know Weber lateralized to the same side if conductive deafness, and to the opposite if there is sensorineuronal deafness. So it is now obvious that the deafness of right ear is sensorineuronal deafness, for which MRI brain is next best investigations. Okay. 2-year-old child bought by his mother. The mother had hearing impairment in her early childhood, is now concerned about the child. What would you do? Audiometry. Condition response audiometry 2 to 4 years pure tone audiogram for greater than 5 years. Less than 6 months autoacoustic emission of brain evoked response distraction test for 6 to 18 months. Okay. A 13-year-old girl complains of a 2 days history of hoarseness of voice associated with dry cough. She feels feverish on direct laryngoscopy. Her vocal cords are grossly edematous. What is single most appropriate investigation here? So here the best investigation, none required diagnosis is laryngitis. Okay. 34-year-old man had a cold 2 days back. He now present with right-sided facial pain. What is the single most diagnosis? Maxillary sinus. This is maxillary sinus. MRI brain. Sorry. No. 36. Yeah, maxillary sinusitis. This is the case. Okay. Now A 29-year-old man with history of asthma comes with post-nasal discharge and bilateral painless nasal blockage. What is the single most likely diagnosis? This is a case of nasal polyp. Okay. A young girl returns from holidays in Spain. She complains of discharge from her ear and complains of tragal tenderness. Exam tympanic membranes normal. Oral toilet has been done. What is the next step of appropriate medication? It's antibiotic drop with steroids. Yeah. Antibiotic drop with steroid discharge from ear and tragal tenderness are features of otitis externa. So the key treatment is oral toileting. Drop advised is Sofradex, Framycin plus dexamethasone. Okay. A 49-year-old man complains of fullness in his left ear, recurrent vomiting and tinnitus. What is the most appropriate medication? Buccal chlorprochlorperazine. Meniere's disease, dilatation of endolymphatic spaces of the membranes, labyrinth causes vertigo, 12 hours with prostration, nausea, vomiting, a feeling of fullness in ear, unilateral or bilateral tinnitus, sensorineural deafness. Fluctuating attacks occurs in cluster less than 20 per month. Case a mystery. Yeah. So guys, I hope till here it's very much clear for you. If you have any queries, any question, you can ask me. And if you still not subscribe my channel, please subscribe it. Thank you. Good day. Goodbye. That's all for today. And if you like this video, put like on it. Thank you once again.